Here to answer your questions about that and so much more is Dr. Vandana Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children. Doctor, thank you so much for joining us.
Thank you, Doctor.
Thank you.
Great to see you. So let's pick it up with the governor of New Jersey. The governor of Jersey says he will now allow school districts to make their own decisions about mask wearing. So to you, I ask, do you think it's time for Governor Baker to do the same thing here in Massachusetts?
I think it's a very nuanced situation. I want to think about masks not as an on-off switch kind of intervention, but as a dimmer switch. And so we have to think about masks as one of our tools, along with social distancing and, of course, vaccinations, which are most important. But the decision about masks should not just be made as masks come off and they stay off, but thinking about the vaccination rates in the school system, the community, the transmission rate, but not just within that particular school district, but where those children and communities are going. Here in Massachusetts, we have so many small towns, so many interlaced, interwoven communities. It's really important to have these decisions be data driven and come back to that fact that it's a dimmer switch. And we might have to increase mask wearing, and just as we might be able to decrease mask wearing as our cases decrease.
So COVID vaccines, they're now available for nearly every student from kindergarten through high school. So are you seeing any evidence that some parents are hesitating to get their child vaccinated?
Absolutely. We can see this both anecdotally in my practice, both as an ID physician, as a primary care physician. There was an enormous push in the early weeks in November, early December, when vaccines were first available. And then we've really seen a plateau. We have not been seeing new surges of interest in vaccine. And as we look at the county by county data, while even counties with excellent rates of vaccination in older adults and even in teens, the rates are much lower in the 5 to 11. And of course, there's enormous racial and ethnic disparities as well, even within well-vaccinated communities.
Doctor, let's get to some questions from our viewers. And this first one comes from Sandy. And Sandy asks, who are these kids in the hospital for COVID, and do they have other health problems?
It's a great question. I think it's important to think about kids coming in with COVID and for COVID. Hospitals are now reporting data, not just the patients being admitted for COVID and as having COVID as their primary diagnosis, but also people who are coming in for other reasons who are diagnosed with COVID incidentally. And of course, with Omicron being so easily transmissible, the numbers being so high, that's been a huge percentage as well. But in terms of kids, while older kids, we're still seeing the same patterns as we saw with Delta, that the ones with underlying health problems are the ones having complications because of Omicron being more easily transmissible and the numbers increasing. We've seen a lot of little kids who really don't have other risk factors who are coming in with croup and other respiratory presentations and no other underlying risk factors. Really underscoring that while COVID is less severe in children, it's not a zero risk game, and children absolutely are at risk.
All right, doctor, thank you so much for joining us. We really appreciate it, and stay well.